Sinusitis is a chronic inflammatory state of the paranasal sinuses. It can be caused by bacteria, viruses, fungus, or even chronic inflammation due to allergies. Most common symptoms of sinusitis include increased nasal drainage, discolored nasal drainage, facial pain or facial pressure, and a mask-like distribution around the eyes, headaches, change in nasality or tone of the voice, making you sound more nasal, and even changes in taste or smell if the olfactory bulb of the smell nerve is affected. You should see an ENT after you fail all conservative therapy. Your first line of defense should be things that are simple and over the counter. Nasal saline rinses, decongestants, antihistamines, nose sprays, anything you can try and do to decrease the inflammation due to sinusitis. After 14 days of continuous symptoms or worsening symptoms between 10 and 14 days, it's a wise decision to consult at least your primary care physician or an ENT. With recurrent episodes of sinusitis, more than 2 in a year, or persistent long-term episodes where you feel like you're chronically congested or chronically infected for more than 3 months in duration, it's a great time to see an ENT because we can change some things for you. When you see your ENT doctor, he'll typically take a look inside the nasal cavity and more likely than not, at least do an endoscopy, which is sticking a small camera inside the nose to take a look and see if there is infectious drainage, if there's swelling, if there's polyps, if there's anything that would tip us off that we would need to do more medications or even offer to proceed with surgical intervention depending upon the findings. Also, we'll likely obtain a CT scan if we find something that looks suspect or out of the ordinary or looks like chronic infection or nasal polyps that may assist in our decision making. It will also likely help later on if you do decide to proceed with surgery. The CT scan will likely help us in navigation in the operating room, allow us to kind of find and determine what's going on. So once you have chronic sinusitis and it's been persistent and you've failed maximal medical therapy with antibiotics and all other ancillary medications, there are several different options. You can keep going with those medications, but unfortunately, after you fail maximal medical therapy, it's not likely to improve significantly. Another option would be balloon sinuplasty or balloon sinus dilation, which is a procedure that we do in clinic to open the paranasal sinuses. It's great for isolated sinus disease or for those individuals who can't make a trip to the operating room. It is not very good for individuals with severe septal deviation or an anatomy that doesn't allow us to gain access in clinic. Classic functional endoscopic sinus surgery has greater than 90% efficacy in patients, and it does require a trip to the operating room, but it is a very good permanent fix for chronic sinusitis. Also, when we typically go to the operating room, we try and address any type of nasal obstruction or breathing difficulties. We'll oftentimes perform a septoplasty and turbinate reduction in concert with functional endoscopic sinus surgery to not only eliminate infection or eliminate chronic inflammation, but also to allow you to breathe better long term. Recovery time varies from patient to patient, as with any type of operation. With functional endoscopic sinus surgery, the first 7 to 10 days is typically very much like an acute episode of sinusitis where you have some nasal congestion and nasal drainage. After those first 10 days, you'll notice that the drainage dissipates, the congestion gets less and less each day, and things like headaches or any other problems that you're experiencing typically dissipate very quickly. At 4 to 6 weeks, you're optimized and it should be very good and totally recovered at that point, but patient recovery varies from patient to patient during that time frame. So at 6 months, 90% of patients have no other significant sinusitis outside of the norm. Normal is to have 1 to 2 sinus infections per year. So if you're having 1 to 2 sinus infections per year, functional endoscopic sinus surgery is not likely to correct or resolve that completely. If you're having more than 2 sinus infections per year, functional endoscopic sinus surgery could be a consideration. Or again, if you're having symptoms longer than 3 months in duration, changes in your sense of taste or smell, increased discolored nasal drainage, all of these open up candidacy for functional endoscopic sinus surgery. Alongside Fess or functional endoscopic sinus surgery, we often perform septoplasty and turbinate reduction to improve your nasal breathing and nasal airway. So not only are we trying to resolve chronic infection and chronic inflammation, but we're also trying to improve your nasal breathing and chronic nasal congestion issues.